to talk about bioidentical hormone replacement therapy. That's what the topic was, so that's what I made my PowerPoint on. The Riordan Clinic approach, I'm just going to give you a brief overview of what we do here at the Riordan Clinic. We like to inform our patients of all their choices. We want to make sure when a patient comes to see us that they know every option available. Even if it's options that we don't offer here, I try my best to give them everything that they can look at. If I can't help them, I'll send them to someone who can. We want to give people hope. And I think through giving them more options, that alone gives them hope. A lot of people think they're doomed with their diagnosis and their illness, and once they've worn out conventional care, they kind of sometimes give up. So we give our patients a lot of hope, and that's very important in the healing process. We want to encourage control. We want our patients, we call them co-learners, because we want them learning, and we're learning at the same time with our patients, to have control of their health. We want patients to take an active participation in their health care, and our patients are the ones doing the work. We're guiding. Okay, that's how we view it. I always stress it is never too late to heal. I have patients say things, and people call in on our doctor call night. Doctor, is it too late? Am I just doomed? I'm 55 years old, I'm 62, whatever their age. It is absolutely never too late to change and to begin to heal. Never. So that's just a little synopsis about me and the Riordan Clinic. So let's talk about hormones. And I like that little cartoon, so I put it up there. Okay, so first off, a quick definition. What are hormones? What I find with patients through the education process, I realize a lot of people don't even understand what these things are. So hormones, and that's really important to understand what you're taking and why you're taking it. I think it's very important. Hormones are basically little messengers in our body. So believe it or not, our body is all connected, right? Every organ system's interacting with every other organ system. So how do they talk to each other? It's absolutely amazing, to be honest. I think the human body is absolutely amazing, something to highly respect. But we have hormones. We have all these hormone glands in our body, all over. Hypothalamus, pituitary, thyroid, ovaries, testes. Even our fat is a hormone gland, believe it or not. And they're just messengers. They're made in the glands, and they are sent out in the bloodstream. So they're not neurotransmitters. They don't go along with nerves. They're sit in the blood. And hormones go into a cell, bind to inside the cell, and turn the cell on, tell the cell to do whatever it needs to do. Okay, it upregulates metabolism, downregulates metabolism. Hormones do all sorts of things. Of course, fertility, thyroid, hormones even talk to your bones and how to release calcium or how to store calcium. They do everything. So it's a little different. A lot of times patients ask, well, what's the difference between vitamins and minerals? I hear magnesium and these certain fats help menopause too. What's the difference? Vitamins and minerals actually are actually the workers in the cell that do all the dirty work in the cell. The messengers are the communicators. They run the cells from a different route. So they're completely different, but you want to look at the vitamins and nutrients too when you're working with hormone health too. That's the whole holistic approach again. They control every aspect in your body. There's lots and lots and lots of hormones in your body, believe it or not. So about the age of 25, 30, supposedly that's about the peak of our hormone. That's when our hormones are at their best. They're highest. That's when we reach our healthiest state. And after the age of 30, that's when hormones start declining. All hormones will start declining gradually, but the sex hormones, estrogen, testosterone, progesterone, DHEA, those hormones start declining more rapidly after the age of 30. So the hormone decline creates the symptoms of aging, okay? So what are the symptoms of aging? Wrinkling, sagging skin. I mean, you guys can read through this, but I'll read them out. Thinning hair, loss of muscle, increase in body fat, more memory loss, brain fog, can't focus, arthritis, pain, depression, fatigue, heart disease, decreased libido. immune capabilities, they get more sick often, slower healing, and bone loss. So typical signs of aging. And that's all the hormones declining, as well as nutrients and vitamins, not just hormones, but hormones are the big factor in aging. So why do some people have worse symptoms than other people? That's a good question, and people ask that all the time. We're all so different. We, very, very different. We all have different influences in our past. So our stress on our bodies, our stress in our life, our nutrition status, our activity levels, or lack thereof activity levels, all sorts of things change the rate of our aging process. So we're all a little bit different in that. So now I'm going to kind of go into some different stages. I'm going to talk about the woman and the man, but some different stages of hormone decline that we have named, I guess. So perimenopause. Perimenopause, what is perimenopause? Perimenopause is, I keep tripping on this thing. Perimenopause is the time before a woman actually is deemed menopausal. So the definition of menopause is a woman has, well, they look at FSH levels if they're really high, but a woman has had a year without a period, and then they're called menopausal. But perimenopause comes before. And this is the interesting thing. It can last, in some women, a year, a month, sometimes 10 years. The patient will have perimenopausal symptoms. I think that the imbalance early on in the late 30s and early 40s is not really perimenopause. I think it's all the other factors, their stress, their nutrition, that's affecting the hormones that we can fix and get them out of perimenopause. So it can last anywhere from a year, a couple months to up to a decade in some women, perimenopause. So these are the symptoms of perimenopause. A woman's cycles become irregular. Normally they shorten. Normally they become like every 21 to 24 days for a while. They're closer together, and then they get further apart. So progesterone declines first, periods shorten, and then estrogen declines and periods lengthen. That's normally what you see. Heavy bleeding, hot flashes, sleep disruption, headaches, dry eyes, vaginal changes, hair loss, weight gain. Usually that's a symptom of progesterone decreasing at a quicker rate than estrogen. So they become more estrogen dominant. Estrogen's up here, progesterone's down here. Estrogen dominant in their perimenopausal years is what the average woman experiences. And let me make a quick note. I think if we all lived in the Garden of Eden, we probably wouldn't have these symptoms. So it has to do with the stresses on our body. If we didn't have all that, we probably would be smooth sailing. So menopause, once a woman hits menopause, these are some of the symptoms women experience. And again, I just want to make another note. Not every woman has this problem. Not every woman has. I have some patients that loved menopause. They felt better. It's rare, but I've had a few. Short-term memory impairment, lack of focus, fuzzy thinking, lack of sexual desire, anxiety, fatigue, depression, mood swings, also known as itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. I love that cartoon. Sorry. The Seven Dwarfs of Menopause. Okay. So that's kind of what happens during that time for a lot of women. So there's also what's called andropause. So men go through this too. It's not just women. Men go through the change as well. And they actually, their hormonal shift is much slower. So they start losing hormones around 30-ish and slowly decline into their 80s. So men can also have hormonal imbalances as well. And some of the symptoms that men experience are increased body weight, low muscle mass, fatigue, loss of stamina and energy, decreased libido, low memory, depression, some of the same symptoms as women. And usually it's related to testosterone, sometimes human growth hormone as well, but testosterone. So that's andropause. So what can we do? We have option A, We can grow old gracefully and accept all the aches and pains and diseases and do nothing, right? Watch everyone else have fun and enjoy life, and we can choose to do nothing. I honestly think if we didn't have all the stresses in our world and we ate the way we're supposed to eat, that's probably, we all would choose option A. That would be ideal. Or we can choose option B. Take advantage of modern medical knowledge, restore hormonal output, modify our diet and exercise, and let others watch you run down the beach. So, I'm very naturopathic, but I also realize that our lives are pretty much limited, our lifestyles. We've had so much chaos out in the world that I do believe in some instances using bioidentical hormones, actually in a lot. I try not to in early stages in women who are younger experiencing symptoms, get them on herbals and nutrition first. They seem to do really well. But at a certain point, especially if quality of life is being affected, I will encourage them to try the hormones, because sometimes we just need our hormones up a little bit to have a clearer mind, have better energy, so we can make the changes we need to make to help everything else in our bodies and our life. So sometimes the hormones can actually bring you, kind of like bringing your head up out of the ground so you can actually get some air and start healing. So we're so dug our holes so deep sometimes. It can be very, very helpful. So what can be done? So if we choose option B, what I always want, I will, regardless if someone says that all they want is bioidentical hormones, I'm going to stress diet, nutrition, figuring out what's the right thing for the person, herbals, mind-body techniques, figure out why their symptoms are so bad in the first place. Usually there's a lot of adrenal fatigue. Adrenals are our stress glands. They're fatigued. The adrenal glands are right on top of your kidneys. They secrete these same hormones. They secrete them post-menopause. So after our ovaries kind of slow down, the adrenals take over. And if we have adrenal fatigue, they're not going to do a very good job. And that's why a lot of us have a lot of symptoms for a lot of years. Okay? So adrenal support, diet, nutrition, exercise, all that's very important. Fat-free diet is not good. A lot of times I do dietary changes with women, and they're very, very shocked at the way I change their diet around. They're like, really? I was told not to eat fat. So anyway. Okay, so what hormones do we replace for women? Estrogen, testosterone, progesterone, DHEA, melatonin, thyroid. Sometimes they also replace human growth hormone. I'm not the biggest fan of that. I don't do it here. There's a lot of side effects with that, but we try to get the body making more human growth hormone. Even exercise can produce more human growth hormone. If you're exercising, your body's going to need to grow more because you're stimulating it, so it's going to naturally secrete more human growth hormone. So I try to go the natural route as best as possible. So what hormones should we replace for men? Testosterone, DHEA, melatonin, thyroid, somewhat of the same. So the big question is, how do I replace my hormones? So really, the two main options are synthetic or bioidentical. So synthetic necessarily aren't artificial either. Premarin is actually from horse urine, so it's really natural. It's not really made in a lab. It's considered natural, but it's not bioidentical to our hormones. What we're trying to do with bioidenticals is we want the hormone to have the exact same structure as the receptor. It's kind of like going to the locksmith and getting a new key. We want it to be the exact same key. We can have a key that's a little different and it'll fit in, but it won't turn. Have you ever had that where you put in the key and you think it's the right key and it doesn't turn, but it fits? So we want the key that fits and turns properly. That's a good description, I hope so. So a lot of times, people ask, well, why is it taking so long for bioidentical hormones to come into play? Why haven't they been used more? Pharmaceutical companies have had to develop synthetic estrogens and progesterones in order to patent their drugs. So if you take the bioidenticals, and this is in another slide coming up, is from yams. It's from natural sources, plants and vegetable sources is derived from it. You can't patent a natural substance. You can't patent it. You can't make as much money off of them. So you can't patent natural hormones. They made hormones. I think the first progesterone was actually discovered from a yam or something, and then they took it and they couldn't patent it, so they tried to make it in a lab almost identical. They just tweaked one little aspect of it, but it fit, but it didn't turn. So they hoped that it would work and not make a big difference in the female body, but that's not the case. So the synthetic ones that don't fit and turn, they're foreign to us. It's not what our bodies are supposed to have. So the synthetic hormone replacement therapy is foreign, but also you realize that there's a lot of estrogens out in our environment that are doing the same thing. From plastics, from pesticides, they're doing the same thing. They're creating dangerous side effects. And the side effects are actually coming from the inability to properly break down the hormones. Okay? So it's real complicated. It's not very, very simple. It's not a direct side effect. It's through an indirect route. So it's really hard to understand. So plastics and pesticides also have a lot of estrogens in them that are synthetic, can cause problems. I just thought I'd throw that out there, let you know. Okay. So risks of synthetic hormone therapy, these are the documented risks through a bunch of research studies: coronary heart disease, stroke, dementia, blood clots, and cancer, and even birth control pills. We know they're synthetic too, and they can create the same side effects. So this was one study, the U.S. Women's Health Initiative. 8,000 women were studied on Premarin and Prempro, and their overall increase in risks: 100% of blood clotting, 41% stroke, 29% heart attack, 26% increase in cancer. So that was one study done on the synthetic. So a good example, I just thought I'd try to give you an example of a synthetic estrogen. Has anyone heard of DES? Yeah, some of you guys have. Usually, I believe, when you go to the OBGYN, they ask you if your mom used DES. Am I correct? So you did. So it was used in the 1950s to the 1970s to prevent miscarriages. And it caused severe birth defects in the fetus. And a lot of the women who were born from those mothers have had reproductive female tract cancers. I want to say it's pretty high. I don't know the statistics. But that's why they ask on intake forms, was your mother treated with DES? It was a synthetic estrogen. And we don't use it anymore. So there was actually not many studies, to my knowledge, have been done in the U.S. on bioidenticals, and the main reason is because they're compounded at all different levels. It's hard to. We're not trying to put women on one thing. It's just hard to study. But they did a French study in 2005. It was in the International Journal of Cancer in 2005. It was a 10-year study of 3,175 women. And they were doing the transdermal and the oral progesterone, and they found no increased risk with the people who weren't on the hormones of cancer, strokes, or heart attacks. That was one study. And these are actually just some quotes from the study. BHRT is Bioidentical Hormone Replacement Therapy. That's what that stands for. So it's beneficial for quality of life, prevention of bone loss, and cardiovascular risk profile without the activation of coagulation and inflammatory proteins. So those are the blood clotting factors. And we were unable to detect an increase in the relative risk of breast cancer. Okay, so those are just two studies I thought I'd throw out there. The safety of bioidenticals is always, patients always ask about that. So that's why I wanted to throw this in there. Dr. Ron also did a lecture, about a year ago, on the safety of bioidentical hormones. That is on our website, a whole hour about it. So if you're interested, that would be a really good lecture to watch for more detailed information about the safety. So, synthetic versus bioidentical, that's the question. So the DES example shows you how dangerous synthetic can be. Also, the dangers of pesticides and plastics that we know about with causing estrogen dominance and problems with hormones is another example of why and how synthetic estrogens are not the best route. Any estrogen taken orally is not good. It has to go to the liver first. Everything goes to the liver, but you have first pass and second pass to the liver, and when you eat, everything goes straight to the liver first. And that can create a problem with oral estrogens. We don't usually naturally orally intake our estrogens, right? They come from our ovaries and our adrenals, so they don't go to the liver through first pass. They only go through second pass. So anything taken orally, estrogen-wise, you want to avoid. Oral progesterone, not progestin, oral progesterones don't seem to have that same effect. So, bioidenticals mimic natural estrogen production. So the benefits of natural hormones. Remember how you felt when you were 25 or 30? So we want to get you feeling better. We want to get you feeling younger. We want to help the symptoms of aging, right? Now, I'll stress this again, it's not just hormones. You want to do everything else while you're doing the hormones, but they can certainly give you that big boost that you need to do the rest of the work. It's identical to what the body makes, exactly identical, hence the word bioidentical. Derived from natural sources, plants, usually the yam is a big source of the hormones. And if taken properly, and if levels are kept within normal range and closely watched, there are no real side effects. Sometimes in the beginning, we'll have breast tenderness or spotting, and we want to tweak them. That's the good thing about bioidenticals is you can easily tweak the levels to the individual woman, because we're all individuals. So the natural estrogens are easy to take. They make your skin softer and more youthful. They completely end hot flashes, usually within days. Usually within the first, I normally do a follow-up within 4 to 6 weeks, and hot flashes are gone. And we'll talk about the form of estrogens we use in just a minute. They maintain bone density, increase hair and nail thickness and growth, decreases body fat, cholesterol and heart disease risk, decreases dementia, and just gives women an overall sense of well-being. A lot of women say, I'm just not me. I feel sad about life, I'm anxious, depressed, I can't handle stress as much. It helps with a lot of those symptoms. The natural progesterone protects against osteoporosis as well, heart disease, uterine and breast cancer. It stops the majority of female migraine headaches. So when a lot of times women are having migraine headaches, it's because of low progesterone or estrogen dominance. And there are a lot of other things I do for that, but we'll talk about that in another talk on another day. But it can help with headaches, decreases PMS symptoms, increases libido dramatically. It offsets estrogen effects, so estrogen dominance, it helps bridge the gap so you're not estrogen dominant. Decreases body fat and decreases insomnia. It helps with sleeping. Helps women sleep. Sleeping is important. Did you know you only grow and heal in your sleep? That's how I get my 5-year-old to bed at night. You need to go to sleep if you want to get big. Okay, let's go to sleep. Works. Natural testosterone cream applied daily, easy to use, increased thinking and cognitive skills, increased decision making, reaction time, of course, increased libido, increased muscle mass, decrease in body fat, increase in well-being. Testosterone, that's why I always wondered why baseball players why are the baseball players the big steroid, they take a lot of testosterone. And it's because they're trying to increase their reaction time with hitting the ball. So it's not necessarily about their strength, it's all about their reaction time with hitting the ball at the right spot. And anyway, I thought that was interesting. So I thought it was just about being big enough to hit it strong enough over the fence, but it's more about the reaction time. So anyway, it helps with that. We do injections as well, testosterone. I don't seem to prescribe those a lot. I don't find those as helpful. Men seem to go up and down a lot more with the shots, so the creams seem to work better. So when do you start bioidentical hormone replacement therapy? Well, you want to start all the nutrition stuff and preserving your adrenals when you're born. You know, when I see women in their 20s and 30s, I stress, you know, we really want to fix this so that later in life you don't have the problems. So you want to start early on with nutrition. You know, if progesterone is low in a 38-year-old, I'll use herbals instead first. It works better, I think. Vitex, and there's a bunch of herbs that help. I prefer not to use hormones early on if all possible. But if quality of life is really bad, they're not getting up, I mean, it's affecting their day-to-day life, then we'll start hormone therapy more sooner. But usually around, 48 to 52, we'll start some bioidentical hormone replacement therapy if the symptoms are needed and their levels are low. So self-test, I put a little test on your desk that you can go through. I don't know if anyone has. I'm sure some of you high achievers have already done the self-test. I would have. And it's just a little silly yes or no test. And let me go ahead and put it on. I'm going to put it up here for people that may be viewing on the internet. I won't read through them. You guys can read through them. But if you answered 5 or more, then you're definitely probably low in hormones. Okay? And I use the word hormones. I mean, there's a lot of hormones out there, but specifically lower in your sex hormones. Probably thyroid and adrenals as well are the big ones to start measuring. Sometimes I'm like, who doesn't have a lot of these symptoms? I think a lot of us are hormonally imbalanced. Thyroid, adrenals, we're all stressed. A lot of us are. So if you answered to 5 or more of these, then you probably are deficient in one of them or some of them. Okay. So you're deficient. What do you do? Again, prevention, of course, is key. And I always say this because I'm hoping people will tell their kids or something about all this and help our younger generations prevent a lot of these things. So, but it's never too late. Like I said, it's never too late to make changes. Even some of the preventative stuff early on makes a world of difference in your symptoms and more importantly, your quality of life. So we want to start doing adrenal fatigue work. We want to start fixing diet and exercise, but again, we're very limited in our modern world. Our culture does not make it easy to be healthy. It doesn't. People are expected to work 15 hours a day. Women especially are way overstressed in this world. So nobody needs to suffer from the symptoms. You don't need to suffer. So if it's really affecting your life, your relationships, your work, raising your children, then definitely get evaluated because there's a lot of things that you can do. You can feel better and you can start right now. Okay? I always say, do not accept to be in pain or to feel bad. Always keep searching for answers. If I can't find it, if we can't find out the answer or help you, then we'll certainly send you somewhere that can. Okay, so a little bit about the Riordan Clinic, how we kind of all collectively approach this in the same fashion. But, the bioidentical hormones are compounded. So what that means is, that we put it all into one vehicle. Well, let me get there. We look at every patient as an individual, like I said. We're not putting you into a box. You come to see me with a diagnosis of hormone imbalance or fatigue or whatever. We're not putting you into a box where all the other, chronic fatigue patients are or whatever. We see every patient as an individual. And we want to closely monitor your clinical symptoms, what we see on physical evaluation, physical symptoms, and everything else going on in your life. And we look at lab values. And we want to measure your lab values via urine or blood, And we want to get them to the level to prevent the complications of aging. So we want to give you the hormones, but we want to prevent a lot of the complications of aging. So again, those are the aging symptoms that we talked about that hormones help decrease. So how we approach it is, we evaluate you. So you come in, we do a history and exam. I mean, I'm very nosy, so I want to know everything that's going on. That's what I tell patients. I'm not, but our bodies are fully connected, and our heart, believe it or not, is connected to our pinky toe. And if something's going on with the pinky toe, I want to know about it, because it kind of helps figure out the cause of the problem. So, but particularly to hormone replacement therapy, we want to do some labs in the beginning. So these are the labs we order usually: estrone, estradiol, estriol. So that's E1, E2, E3. There's different estrogens. Progesterone, testosterone, and DHEA. We normally do it blood or urine. I don't do a lot of salivary testing for these hormones. The times that I do are when I'm working with an infertility patient or patient who is infertile or deemed infertile, and we're looking at the changes over the course of a month. That's when I think it's very accurate, because you can kind of see how the hormones are cycling. Otherwise, we don't do salivary hormone checking for those hormones. And if you're coming in for bioidentical hormone replacement therapy, we normally also would recommend thyroid and adrenal testing if that hadn't been tested, so we can have a good look of those major glands all at one time to see how they're interacting and working. So the lab is done by the patient. We order the lab, we receive the results, analyze it, and write the script for the bioidentical hormone therapy. So in the script, we normally put a combination of estrogens, estradiol and estriol, okay, E3. And E3 is actually has been deemed very protective in breast cells and in the body. Supposedly, the more E3 receptors a breast cell has or is stimulated, the less risk of breast cancer. So you want to have the E3 in your prescription. So we normally do a combination of those: progesterone, testosterone, sometimes testosterone in women. DHEA, that's another hormone that's a precursor to testosterone. It's also a precursor to some of your adrenal hormones. So sometimes in women, I keep the testosterone out, especially if they're within normal, and just put DHEA. We can add other things. A lot of times I add methylcobalamin, B12, if a patient has problems detoxing, or if they've had endometriosis in their history or some sort of estrogen dominant sort of diagnosis. So we write the script. It's made up at a compounding pharmacy. So Walgreens can't do it. Walmart don't do these scripts. So basically, they have all the ingredients and they compound it in a certain vehicle: cream, gel, sublingual, and troches. So I tend to use the creams and the troches the most. I was taught more with the creams in school, and then started utilizing a lot of the troches once I got out. Troches seem to be a little bit easier to regulate in women. Oh, okay, troche. Yeah, she asked the question, what is a troche? I didn't know what that was either. It's just a little sublingual it almost looks like a little piece of wax or something. And you just put it in the back of your cheek, and it dissolves. So it's kind of sublingual or in your cheek membranes. That's how it dissolves. You don't swallow it. It takes a while to dissolve. Some women don't like it. Some women like it. I've done sublingual drops, so under the tongue, drops that you do under the tongue. Creams. I don't really do gels. Sometimes they do it in capsules. I don't do oral at all for any of the hormones. I don't think Dr. Mike does either. He tends to use more creams. I just always think the troches seem to work more quickly and are easier to get to the appropriate level more quickly. So we carefully monitor your symptoms. So we may change doses in the beginning. So when we start a woman on hormones, I normally have them follow up in 4 to 6 weeks. We give them a little symptom questionnaire for 3 months in a row, and they rate their symptoms on a scale of 1 to 10. So we review that. We don't necessarily rerun labs right away at that time. Usually with clinical symptoms and looking at their initial labs and the changes, you can kind of tell what to tweak. And we'll make the necessary changes. Sometimes a woman does great everything's perfectly fine and we don't have to make any tweaks, but we'll rerun the labs in 6 months. We want to make sure we're not overdosing or there's any other issue. I also run the lab that looks at the metabolism of estrogen, because a lot of women are nervous about the risk of cancers and stuff. So the metabolism of estrogen gives me a better idea if the patient is at higher risk or not. So if they're not metabolizing well, then I put them on other things to help them metabolize estrogens. Lots of cruciferous vegetables, methylators, that might be foreign words to you guys, but things that help with detoxification. So again, you have to take that holistic approach. First, do no harm. So that's what we do. So again, we're committed to the holistic approach. So, and again, based upon personal and family history, every woman's different. So I try to treat, even when someone just wants bioidentical, I will give all the recommendations that I think they might need to consider doing. And most people are pretty appreciative of that. So those are the things: omega-3 fats, indole 3-carbonyl dim, that's what's in broccoli and cauliflower and cruciferous vegetables that helps your body detoxify estrogens out. So sometimes I put women on that, and the methylators, B12, methylfolate, MSM, sometimes I recommend those things. So that's just an idea of the holistic approach on top of the hormones that we utilize. Okay, well, we got, 9 minutes left. 9 minutes for questions. Now I'm going to go ahead and get your questions. I have some frequently asked questions already on this slide that I'll go to after I let you guys ask questions first. Yes?
I'm a little confused about the progesterone, oral progesterone.
Mm-hmm.
I just learned about choking now too. And is that a better way of taking progesterone than orally, than swallowing a bioidentical pill?
Like the progesterone orally, from my understanding at this point, Dr. Mike may know a little bit more about this. The oral bioidentical progesterone doesn't seem to have doesn't seem to be a problem. Oral pill.
Okay.
It's the estrogens that do. Now progestin, people get confused. That is a big risk, and that Dr. Ron talked about that on his lecture about a year ago, about all those differences. It's a fantastic lecture. I was here for it. It's a great one to look up. Dr. Ron, Google Dr. Ron, YouTube, bioidentical hormone. It's on our website. I think it's on our website. But he talks a lot about that. But from my understanding, Dee, at this point, bioidentical progesterone orally shouldn't be put you at higher risk.
Do you do
Yes.
compounding in the pharmacy here?
So the question is, do we do compounding in the pharmacy here? Here at the Riordan Clinic, no. We send it to a compounding pharmacy outside. We don't have a license to compound pharmaceuticals. Yeah, good question. Yes, ma'am.
I have been on to bioidenticals for 8 years of treatments, and my concern is the insurance companies, are they still going to support the compounding pharmacies? Or I've heard that that's going to be an issue that's soon coming.
So the question is, she's been doing bioidenticals for 8 years and is wondering about insurance and the compounding pharmacies and probably the FDA and all that mess that's going on with the compounding pharmacies. I actually had a slide on that, but then I took it out because I didn't think I'd have time to go over some of that. Insurance right now, some insurance companies are covering bioidenticals, as my patients tell me. Some of them aren't.
Mine does, but
Yours does.
But it's the government is now regulating, and it's soon not to be.
Yeah, that's why we want people signing that waiver and doing everything they can to prevent a lot of that. There's a lot of stuff going on now. I don't know all the details, but all I know is a lot of our compounding stuff we cannot get a hold of. Patients are getting angry, but we cannot get it because the compounding pharmacies are having issues with the FDA and everything. They're trying to control a lot of things. And the reason behind that is they haven't been FDA approved, but they can't because they're so individualized. They're changing the doses. It's not mass produced. So really that's better. We're not all the same. We need to be tweaked according to our own personal lab values, clinical symptoms, and everything. But I'm not sure what's going to happen with all that. So that's a very good question. I apologize I don't have any more answers. So, yes, this gentleman right here.
Organic meats are very expensive. How important is it to be organic and eat meat?
I personally think it's very important. Organic, grass-fed, grass-finished beef is the best beef you want to get for the omega-3 fats, and you don't want, at least get the beef that's not treated with hormones and the beef that are eating grass that's not treated with hormones and pesticides and antibiotics. They even give antibiotics to the cows to beef them up too, because it helps beef them up as well. So I think it's very, very, very important. You know, I understand it costs a lot of money. So I try to sit down and help patients figure out their finances, where to spend the money, where they can remove some of the things they're spending money to spend it on the healthier stuff. I think it's huge. I mean, of course, I don't always eat that way if I go out or something, but I think, you know, 80% of the time or while you're at home, that would be the best bet. Not everyone can afford it or can get it, but I try to stress, especially if there's a hormone problem. If a woman has endometriosis or infertility or something, then we stress that. Good question. Yes?
Do you cycle or do you tend to use your hormones?
Do I cycle or tend to do continuous hormones? It depends on the age of the woman, if she's still cycling herself or not. If a woman is menopausal, what I was taught in school is not to cycle them. We do it continuously. But every now and then we'll take a week off here and there, but normally it's continuously. But see, women that are cycling, I normally don't, they're not menopausal yet. I try not to use a lot of the hormones so we don't cycle them anyway. We do more herbals. Sometimes I do and I will cycle according. Yes?
Do you have a philosophy on an age limit for the BHRT?
Do I have a philosophy on an age limit for BHRT? I always say, you know, you don't want to, or the research has shown, if you're 68, 70 and you haven't started hormones or never been on hormones, it's probably best not to start them. If a woman, I look at quality of life and weigh the pros and cons there. Careful monitoring of all the lab values and look at their history. If we feel that it's safe to do and quality of life is not good, then we'll certainly try them if they're older and have never been on them. I always say right around menopause is the time to start them. Some people say lifelong continuum. I was taught in school 3 to 5 years to be on hormone therapy. A lot of people are on them a lot longer. I think if you're doing all the work underneath, like a true committed naturopathic patient, usually can get off of them within 5 years a lot of times. So what we'll do is gradually try to wean off hormones, decrease bias a little bit for a few months and then try to do that. But studies show it doesn't seem to cause much of a problem for long-term use with bioidenticals, but that's kind of how I was taught in school, 3 to 5 years. Yes?
What compound pharmacy do you use? Is it locally?
What compound pharmacy do we use? I'll use different compounding pharmacies. We see patients from all over the country, all over the world, so if they're somewhere else, we'll use a different one. The one I tend to use more here in town is locally, Custom RX. I utilize a lot. Heart Pharmacy we utilize here in town. Dan Duran's, I know, compounds.
Do they all use different base ingredients for
Yeah.
the creams?
That's a good question. I think they do. They do have different bases. I'm actually meeting with one of the pharmacists at Custom RX next week, and we're going to go over a lot of that stuff because I'm not quite sure. They use different flavorings. I don't order it.
Uses yams on the base, but I have extreme allergic reactions.
There could be some other fillers and flavors, and sometimes if it's stevia in them. So that's why I'm going to meet with some of the pharmacists in town and find out exactly what's in it because we have people that are sensitive to all sorts of things, and I really need to know exactly, besides the estrogen, progesterone, testosterone, what are they putting in as the base? That's a good question. Yes?
I personally just had that happen to me for years, and he says
Mm-hmm.
I had an extreme reaction.
Did it get better changing the base?
Oh no, when they changed the base, oh no. I
Yeah.
couldn't get my rings on, I was bloated up, I was just, like, there's no way I could use the new base.
And they changed the base on you without telling you, right? Yes. And that's what happened.
They went back to the other base, and I don't know, I know one thing was stevia,
Uh-huh.
but I don't know what else they did, so I was a little concerned about that, because to me, I thought it was stevia instead. So I don't know what it was, but I was the first person they had react to, but I didn't realize that there were different bases and.
And I'm actually, I mean, I realize that, but I'm realizing that more now that they're changing them like that, and I didn't know. That's why I'm meeting, one of the reasons why I'm going to meet with some of the pharmacists in town and find out, because I'm really particular about additives, and if anyone's my patient, they'll know. I don't like all the chemicals and additives and things, so I should know what's in them. So that's why I can't answer exactly, but I will find out.
And I had heard that, because my friend gets her stuff at heart, and hers dissolves a lot quicker.
Mm-hmm.
And I'm like, forever, that trophy is in there, this just drives me crazy.
Yeah.
So I was kind of like, well, maybe there is something different, and then when they switched.
Yeah, I talked to Mary down at, she had Heart? Yeah, Mary at Heart. She's a pharmacist, or she works with them or something. She does sublingual drops, and she finds that work well. So I've used those with quite a few patients that were having that trouble with the troches, or, I mean, it gets all over their teeth, and they were telling me it takes 45 minutes to dissolve. Some patients say it doesn't take long, so I don't know what. It might be a difference with the pharmacies, but the sublingual drops seem to be working with some of these patients that I've switched to, and they dissolve within 30 seconds.
Yeah, see, mine's in there forever. And it's like,
Yeah, and the cream's another option too. The cream works pretty well too.
yeah, that's what I noticed in the article about the creams, because I thought, well, because also my, what is it, the sex hormone, mine is very high.
Mhm.
So that means I was kind of swallowing.
You might be swallowing a lot of them. You're having that first pass through the liver.
And I think the trophy's in there so long. I didn't
Mhm.
want to be careful, but I think it's in there so long.
That's why it's important to measure the labs too, because you can see all those things on labs, and you want to make changes to help the symptoms, but you also want to make sure we're not causing harm. That's why labs are important. Yes.
There's recent research on low levels of aldosterone and hearing loss. Is there a way of increasing those levels of aldosterone?
You're talking about aldosterone, one of the adrenal hormones. I know there's pharmaceuticals for aldosterone. Adrenal support is very, very important. If you have like fluid, you're having fluid and urinary symptoms, and because aldosterone works on the kidneys with fluid, with water, changing water back and forth through compartments and stuff. So I can see where it can cause hearing problems with the fluid in the ear moving. So I would guess with aldosterone deficiency, what I do is adrenal support. Sometimes there's pharmaceuticals are used. There's a, what is it? Not Cortef, that's cortisol, but I don't know. There's a bioidentical aldosterone that can be used as well. I'm pretty sure. Don't quote me on that. I have to look that up. Yes.
I've been on hormone replacement therapy for years, and I switched to taking the estradiol patch. And so that would be less harmful, taking the patch, since it does not go through your liver.
So you're doing the Vivel dot, one of those estradiol patch.
Estradiol.
Now estradiol, that's a tricky one. They're calling it bioidentical, but it's not really bioidentical. I mean, it's not really naturally bioidentical, from my understanding. The patch seems to be, the Vivel dot, the estradiol patch seems to be not as harsh. I still think doing E2, E3 combo is important, and adding progesterone in regardless. Even if a woman doesn't have her uterus and stuff, still giving progesterone. Yeah, a lot of times the standard is if you've had a hysterectomy, they don't give you progesterone, because they give you progesterone to protect the uterus with the estrogen, but progesterone is used elsewhere in the body that could be, you might need more of for certain reasons. It all depends on what your values say, what your symptoms are. It might be worth trying to, switching. And I've taken a lot of women off the patch. That's a good question, or off Permarin or whatever, and shift them towards the bioidenticals. But it all depends on your clinical picture and if that would be the best, the best choice for you. I I personally would say it's probably a little bit better. Because I see people on the patch still having insomnia, still having muscle pain and some other things and arthritis, but that might not be your case. So that's a good question. Yes?
When you say first and second, is it PATH, P-A-T-H, or P-A-S-S?
PASS, P-A-S-S.
Okay.
I'm probably saying things that I probably should define or going into more detail than I should.
No, that's fine.
But first pass, everything you eat goes to your liver first. Because you could be eating, all those chemicals and everything that you're taking in, all the stuff flying in that you're swallowing, your liver protects you and it goes there. That's called first pass. And then everything your body secretes has to be detoxed in the liver as well, and that's called second pass. But pass, yep. Good question. Yes?
Yes, does most insurance cover visits here, or is this one of those places?
No, we are pretty much cash based. We do, I don't know what we're going to do in the future, but currently we give the HCFA forms and patients can get reimbursement for the visits. It's a hit or miss. I never hear from patients that they got covered. Sometimes they'll tell me, oh my gosh, they covered everything, even the IVs. And I'm like, wow, okay, that's great, surprisingly. Sometimes they don't. So I always say contact your insurance company, get as much information as you can. But I always tell patients, be prepared to pay the cash, and then be excited when you get the reimbursement. Sorry, yeah.
That's probably going to go for Medicare too soon.
Yeah. I don't know what we're going to do. We're in the gray area with Medicare too. We don't know what we're going to do. Yes?
We can talk about that usually you put patients on 2 to 3 years. So, and I told you I've been on for 8, but what are the consequences of not? I mean, if things are going well and your levels, blood levels and, are right where they need to be, why would one go off?
That's a good question. Why would one go off hormones if everything's where they need to be, if patient feels good, why should they go off? Bioidenticals, there's really absolutely no reason to go off. I just was taught 3 to 5 years and try to wean the woman off if they can.
That was the synthetic.
Yeah.
I mean, that's what I was told on synthetic pharmaceutical. You don't want to be on it for very long. But the natural ones, from my understanding, is it's okay.
Yeah, from the research thus far, it is okay. They say long term, you can stay on those hormones. But I would just say, I would always recommend closely monitoring your labs and everything, and how your symptoms are, and make sure everything's going well. Yeah, I don't see a reason. I'm just conservative, and if we can get off, a lot of times patients want to get off mainly because of cost, or they're just tired of doing it every day, and they want to see if their body can now function without the hormones, and that's why we wean down, usually.
Can you just take the test here?
The question is, can we just take the test here? Yeah, you can come in. You mean just come in as a patient, get tested, and then decide what you want to do with bioidentical? Oh, absolutely. Absolutely. We'll give you out. I have patients who are in menopause, perimenopause, and they do not want hormones. Or past menopause? Oh yeah, I do it past menopause. We don't do hormones. We do herbals, we do nutrition, we do all sorts of other things to help with symptoms and stuff. You don't have to do just hormones. We're talking about that just because this is what the talk was about.
Yeah.
But, I do all sorts of things. And if the patient doesn't want to do something, there's other options. I will tell you if I think, yeah, you should do this just for a while to get healthier so you can do all the other things I'm telling them to do. A lot of times they're just so fatigued and can't think, and it's even hard to go to the grocery store and read labels and get the chemicals out. So you got to work with everyone where they are. Yes.
I have a question. On adrenal support, is there anything that you recommend people take, or should you test it first?
Well, I like to see where patients' adrenals are first, so we kind of have a guideline of where they're starting. There's a lot of different herbals, vitamin C, B5, IV vitamin C, Myers, fantastic for adrenal fatigue. That's why they're used for so many things. The B vitamins and the vitamin C that we use in our IVs, fantastic. Also, all the other lifestyle, techniques, working on relationships, that's big. stress in their life, work, if they're working 18 hours a day and their boss is hounding them, and it's hard. I mean, if they can't change it, we do IVs, we do everything we can to support them. But nutrition, supplements, IVs, exercise, meditation, yoga, I mean, there's a lot of different things we can incorporate to help the adrenal glands.
But you can get a test.
Yep.
To see where you're at.
Yes, ma'am. Yes, you can test your adrenal glands. Wonderful questions. Let's see if here's all my questions. Can I switch from Primpro, Premarin, Vivel Dot, et cetera, to BHRT? Yes, you can. Sometimes, especially with the patch, usually in the younger women who have had hysterectomies for surgical reasons, like surgical menopause, that they get on Vivel Dot, they tend to not do well. Usually, after about age 55, Vivel Dot's not as bad. I think it's because they're needing more progesterone. They don't do as well on the Vivel Dot, so I'll wean them off and put them on bioidenticals. A lot of women have hysterectomies in their 20s and 30s and or go through surgical menopause. So, do they increase risk of cancer? We talked about that already. How long does it take to see results? Usually within days, and women will report starting to see results, but it can take up to 6 weeks to get the full benefit. Do I need to take these hormones forever? We've already talked about that. Why don't conventional doctors prescribe it? They weren't taught it in school. They don't have much experience with it. It's not their specialty. Just you do what you're used to. They don't have time to learn about it or get trained in it. So that's one of the reasons why a lot of them don't use it. It takes more careful monitoring as well. So, the future looks bright and the time is right. So, there's never a better time than now for you to experience all the benefits of hormone replacement therapy and everything else the Riordan Clinic has to offer. So, I always say you can't go back in time and make a brand new start, but you can start now and make a brand new ending.